Council General Sahab, Council President Sahab, and most of all, obviously, all the guests who are here from around Chicagoland. Thank you so much for being here today. I gotta say that as I begin, I am a little nostalgic. I myself was born not far from here, in Zanesville, Ohio, and then grew up in Huntington, Indiana. Some of you will know there, it's near Fort Wayne. And we used to drive up here to enjoy jalebi on Demont Street. And so coming to Chicago, which is such a benevolent city, it really feels like coming to a place where you feel warm and accepted and loved. So thank you so much for having us here today. Now you heard the CEO, Dr. Shafi, my good friend, basically give you all the material. And so what am I supposed to talk about? So he said, you should just explain why the people that are here, how this relates to them. And I'm like, oh, that's an easy thing to do. You get to use all the data, and then I have to somehow explain why you're here. Right? Now, in that, when we were talking about this, Mr. Noroz Surani, where's Noroz? Right here. Right? Noroz is right here. He's so tall, we can see him all the time. Noroz reminded me that it's Iqbal Day. So he said, "Aapko sher pad jayega." Now, remember, I grew up in Indiana. There wasn't a lot of Iqbal going on over there. So then I said, okay, aap mujhe aisa koi sher WhatsApp kar de. Okay. Is it okay if I kind of do English Urdu like this? It's okay. Yeah. All right.
Exciting.
All right. So the sher he said was, I'm usko padunga na taकि गलत ना हो जाए. खुदी को कर बुलंद इतना, खुदी को कर बुलंद इतना कि हर तकदीर से पहले खुदा बंदे से पूछे बता तेरी रजा क्या है. Now I didn't really understand. You'll explain. So what I did is I did what most people will do when they can't understand Urdu, and I'm sure many of you can relate to this, and maybe you have been on the receiving end of that phone call. I called my father. I said, Abu, ye mujhe sher ke bare mein thoda sa jane. So he explained that the idea is to raise yourself to such heights. Raise yourself to such heights that luck will be on your side, and God may actually ask you, what do you want to be written in your fate? That's incredible. It's impressive. And we make ourselves, so that Iqbal is like saying you need to really raise yourself up. But then my dad, who by the way loved Chicago and had his first job in Chicago and sort of grew up in Chicago, my uncles have lived in Chicago. He said, you have to be careful when you talk about this. Because if you're going to be talking to people of Pakistani origin, many people left Pakistan and came to America because they realized that even if you were able to do what Iqbal said, which is to raise yourself up, perhaps, and he raises this question, and I don't agree with everything he says, but perhaps the playing field is not even. And so even if you raise yourself up, you may not be able to achieve what you achieved. And that, in fact, at the same time that when Iqbal was talking about this share in the 1930s, in 1931 was the book, The Epic of America was published, in which they talked about the American dream. Right? The idea that no matter who you are, no matter where you come from, with hard work, khudi ko buland kar de, right? With hard work, you can achieve anything. And so he said, be careful if you're going to use that share when you talk to Pakistani diaspora. So all the facts and figures have been given by the CEO, but since I'm a professor, I'm going to lay this proposal to you. To ask the question, is there a place in Pakistan where if you listen to Iqbal and if you do hard work, you can achieve anything? And I'll give you 3 stories, and I'll let you make up your mind if AKU is one of those places. The first story is of Zubaida Siraj. Zubaida was born in the northern areas. She grew up over there. Many of you know that Aga Khan Education Services has many schools in the northern areas, right? Gilgit-Baltistan. She went to one of those schools. She was outstanding, superstar student. She was one of the students who were admitted to the Aga Khan University's medical college program. The MBBS program that Shahid and I both are very fortunate graduates of, this year, there were 6,000 applications for 100 spots. Shahid mentioned my previous job where I used to work in Boston. Trust me, they don't have 6,000 applications for their 140 spots. The most competitive medical college, one of the most competitive medical colleges, where she did a fantastic job, and then she wanted to be an eye doctor. So she trained in ophthalmology at the Aga Khan University Hospital. So as we said, there's a medical college, highly competitive medical college. By the way, the medical college, somebody was asking me this, so I'll just make sure you know. The medical college is #1 in Pakistan. It's in the top 100 in the world, and #1 in Asia. And the residency programs, after you finish medical school, you do residency. She got into residency programs. We have 35 different residency programs, 35 different ones. Think about it, and we have it. And we even have 37 fellowship programs. So what does that mean, right? I mean, you want to go into medicine or surgery, go residency with you. And then you want to subspecialize, vascular surgery, breast surgery, electrophysiology of the heart. That's a fellowship. We have 37 of those. So she did her residency in ophthalmology. Then she actually got a fellowship to do subspecialty in Ireland. She went to Ireland. She did her subspecialty training. She even wrote a book about how to train ophthalmologists, which won multiple awards. And then she's like, I'm going to come back to Karachi, to Pakistan. And as dean, what I do is I actually meet with every single new faculty member who's coming on faculty. I meet with every single one. And the reason why I meet them is I want to understand, what they want to do with their lives, what's their future, how I can help them, and so on. And I just casually said, so aapne kya karna? She's like, I would love to have worked in Chitral or Gilgit. But वहाँ कोई eye surgery की जगह ही नहीं. So then I literally while she's on the phone, we were doing a Zoom call. I said, wait a second. I went outside my office so she could see me. I said mute bhi kar sakta tha. I don't know why I didn't do that. But I got up and went outside my office. And I phoned the head of the Aga Khan Health Services. And I said, if I can find you a faculty member, fully trained, can you create an eye clinic in GMC, in Gilgit Medical Center? They said, I'll do that immediately. So then I came back and asked her, suppose we made you faculty at AKU Karachi, but you do a lot of work up in Gilgit. Will that work for you? She's like, that would be a dream come true. Ladies and gentlemen, I'm proud to say that Dr. Zubaida Sarang is now doing full-fledged operations in Gilgit for cataract and a variety of... Let me tell you another story. And we're talking about women empowerment. And did everybody see Malala got married yesterday? Right? Isn't that beautiful? We should give her a round of applause. So there's a family of doctors, the Samads, and they all come from KPK. One might look at their family and think they're very conservative. But what one would know is that almost everybody in their family, including all the women, are doctors. One such young woman, her name was Zainab Samad. She went to St. Joseph's School in Karachi, which is a very good school. Some of you know it, apparently, and then came into AKU. At AKU, she was one of the top students. She did her clinical electives. Somebody was talking to me about coming to Pakistan, coming to America to do electives. She did her clinical electives at Duke University. From Duke, they told her, look, when you graduate, come back to Duke. She went back to Duke, and when I met the dean of Duke, he told me that this was the most brilliant resident he had ever trained in his entire life. She wrote 100 publications. She made a big name in cardiology, data science. She was one of the people who looked at how your cardiovascular risk factors will impact your outcomes, and she's one of those heart doctors who use big data to figure out who should be on a statin, for example. Are any of you on statins, right? Some of you must be, right? So she's the person, आप डॉक्टर पास जाते हैं, बैठ के आपको रिस्क बताते हैं, कितना रिस्क लेना चाहिए, नहीं लेना चाहिए. She's the person who figures out that data. But she always loved Pakistan, right? Her husband's also from KPK, he loves Pakistan. And they said, maybe we'll go back to Pakistan. And then came the opportunity to become the department chair of medicine at Aga Khan University. And she left Duke to come to Pakistan in 2018 to become the chair, the first female chair of the Department of Medicine. Not only is she leading, yes, you should definitely give her, there you go. Not only is she the first female chair of the Department of Medicine, but she is also leading this whole health data science initiative, where she has figured out, the risk factors for heart disease in Pakistan, but more importantly has figured out worse outcomes. And she has shown that women are far more likely to die from cardiac disease than men in Pakistan. And you know why? It is because of the bias that we have. Let's call it a positive bias towards men, that if there's a 45-year-old male who complains of chest pain and has a stressful job, we say, isko to heart attack ho raha hai, isko fauran अस्पताल ले जाओ. But if a woman is having all the symptoms, having the pasina aa raha hai, dard bhi ho raha hai, सब कुछ, we say, koi stress hai, nothing. And then the person doesn't make it. Right? But she has done research to show that. And Zainab Samad, you'll see, you remember that name. It's incredible what she's been able to achieve. And remember, she's one of hundreds of faculty members who are really leading healthcare in Pakistan right now. You heard all the statistics from Dr. Shafiq about how many faculty members were really there in the COVID response. Let me tell you, I was very much involved in how we managed COVID. Please understand the fear that we all must have had. Because we saw you here in America drowning from this disease. We saw people putting, bodies in refrigeration trucks, right? This is what we were seeing. And we had no idea how our healthcare system, which is such a fragile healthcare system, how are we going to stand up when countries like the United States are falling apart? But our physicians, our nurses, our other healthcare practitioners, I gotta tell you, they didn't miss a beat. They really stood up when they did not know how they're gonna handle it. And when they did not still have vaccination. I gotta tell you, not a single person ever said no. When we said, "Aap yahan kaam kar le, can you take care of this call, can you take care of this?" In fact, our own resilience was such that we created a tele-ICU project, where, Pakistan has 26 certified pulmonologists. We had received all these ventilators from China, for example, but not everybody knew how to run the ventilators. So spoke to the Federal Minister of Health, he called and said, Adil, is there something you can do for us? So overnight, we created a tele-ICU system where people who are on ventilators all around the country, we were managing them from a nerve center at AKU. And we used Zoom, we used other software, and if everything failed, WhatsApp. Right? The doctors over there would send us a short video on WhatsApp of how the patient is doing and what the ventilator settings are, and we would give them advice on what to do. So just incredible stuff. And then finally, maybe, since I'm a surgeon, and surgeons are never humble, right? The third example I'll do, is that's the easiest one for me to do, is about myself. Shahid has already introduced me I'm very grateful that I got it done to the Aga Khan class in 1998. By the way, I didn't get in the first time. And as dean, when I tell students who don't get in the first time, I tell them I didn't get in the first time. I tried again. So that year I tried really hard, and I got in the second time. AKU was a dream, studying there. This is the late 90s, and those of you who will remember Pakistan, there was a lot of strife going on, a lot of problems going on, and we'd walk into AKU and it felt like an oasis. You just saw the beautiful buildings now. It's just an incredible place to learn and to grow. And when Zara Rahmatullah, the 2024 medical student who gave you that tour, it's like, it gives me chills down my spine, because I can totally feel what she's saying. Right? Because I've mentioned that, because you were that we had an apartment on the Diwan. I came here, I gave my USMLE, and then I phoned somebody who Shahid knew, Susan Baker at Johns Hopkins, and I said, gee, I want to come do research or maybe get a job. She didn't ask me where I was. She just said, "Kal, meet me tomorrow at 3 p.m. I was in Chicago, and 3 p.m., it was already like 6 o'clock in the evening. So I remember and it was snowing. I didn't tell my parents, they would have killed me if they knew. I almost killed myself driving on the Pennsylvania Turnpike, right? Have you ever driven on one of these things? And in Chicago, you can relate to it, right? That you're driving and on a semi-truck, the barf, oh my God, it's the first time that ever happened to me. It was so scary. But I got to Baltimore and I met Susan Baker, and only in America, right? We said that only in America. She gave me a job that moment. I told her Shahid Shafi had sent me. He had worked with her. And she said, oh, he's from AKU. You're from AKU. I'll give you a job right now. And that's how I got to work at And so I got to work there, and then I got to work at, it was mentioned that after many years at Hopkins, where most of my work was on healthcare disparities, and many of you will know about Obamacare and health equity and so on. And a lot of the research that's based on this, I'm fortunate to have been part of the teams that did a lot of that work for health equity and so on. And then I got recruited to go to Boston, and in 2018 I received the Ellis Island Medal of Honor. And during that, I got to tell you, in one of that year, I'll tell you who got that's the same thing. I shared it with Buzz Aldrin, the second man on the moon, Fareed Zakaria, and Indira Nuri. She was the CEO of PepsiCo, amongst others. It's an incredible ceremony. They actually take you to Ellis Island, they give you the medal, and on the way back, they turn a boat in front of the Statue of Liberty, and they do fireworks. And I remember Fareed Zakaria, that CNN commentator, saying to me, Adil, take this in, because there's never ever anybody's going to do fireworks for you in front of the Statue of Liberty ever again. And we both met, and people talked about it, and we said, okay, this is what it is, right? So many of us have come from the American dream, and my parents were there with me, and they were all so proud, and everybody there, it really felt like the American dream. But I gotta tell you, moving back to Pakistan, many people say you haven't moved back to Pakistan, they say you moved back to AKU, right? That has been the most incredible opportunity to serve through COVID, right? At AKU, leading that response, helping to lead that response. Can you imagine how amazing that opportunity would have been? And so, as I close, I just want you to think about, if you think AKU, how AKU relates to you. And I know so many of you are here in America and you're living the American dream. But I can tell you that I am so grateful that I got to go back to Pakistan to live my American dream. Thank you so much.
Adil and Shahid, if you can come on the stage here, and we'll take the question as it comes. So do we have an extra mic? Can you?
The CEO and Dean share. Go
No, for them to ask questions. Okay, questions?
Yeah. Go ahead. Yeah.
Thank you. Dr. Ray, you're all announced that much with you in common. And when I came to America 50 years ago, American doctors, now we are over 20,000. The AKU alumni are very important, integral part of Apna now. Our current president of Apna is the first time in 40-year history of Apna we have AKU alumni who's president of Apna. So, for somebody from say, Karachi, Hyderabad, I have seen all this really in front of my own eyes. And I've been there several times, and I have several family members who have gone to medical school there. I think whatever you have said is not only true, but I think you have underestimated your own capacity. I think the contribution to the country and few ideas, and this is my main point, is I think asset to Pakistan, there are a lot of people here, businessmen, engineers, and yes, doctors. We need to start a movement to get these people back to Pakistan, like you have done, to build the country. I think let AKU be the leader and be the first to start a movement to get back the asset.
Well, as much as I appreciate what you said, Dr. So first of all, thank you so much, and I want to recognize Apna President, and so coming from you, this means a lot, what you just said. It really, really means a lot. But I want to say, Dr. Saab, as much as I appreciate that, because it would help me recruit people, because I'm always trying to recruit someone. I'm looking for a new chair of radiology, by the way, if you know anybody. Whereas it's great to get more people to come to Pakistan, the key that we're talking about is the feeling. We want you to know, and all of you to know, iska AKU se taluk nahi hai. We want all of you to know that there is a lot of possibility in Pakistan. And AKU is an example of what can be done. And that's what really we want you to know. And so if you want to come back to Pakistan or you want to contribute in another way, AKU is an example. And if you want to work through AKU or work with AKU, we are here. You will have all of our information. We're very happy to facilitate help. And also, if you want to donate money, I'm happy to take it. So, I wasn't supposed to say that, but the bar got it.
So, well, I'm just gonna start. But Dr. Rain just mentioned starting a movement. Here's an example. People in my WhatsApp group want to start a specific orthopedics department. I think he already talked to you, which doesn't exist over there, that particular branch. So in my group, so this is one of the people who are inspired and they are planning to move back. But more on a healthcare note is you mentioned something about women's cardiac events. And in United States, I don't know about Pakistan, but in United States, all the research has been done on men. And I keep telling our healthcare system that there's no research on women, and women cardiac symptoms are very subliminal, and there's not enough research done. So I don't know if Aga Khan is leading any particular research, as you mentioned, women empowerment and research initiatives. If you have any progress, made in that regard.
I'll make a research response, and then maybe Shahid can talk a little bit more about women empowerment. You were absolutely right in what you've said. And in the United States, the National Institutes of Health has shown multiple occasions that women are not represented in research the way they should be, nowhere near, and especially underrepresented minorities are completely not represented in research, and that is, of course, much to the detriment of society. One good thing about being in Pakistan is we can learn from other places. even in COVID, one thing that did happen to our benefit was we learned a lot about what was happening in the West, and we applied it immediately. And so that lesson is, we are learning that lesson very quickly. Just this Monday, at the Aga Khan University, I'm very proud to tell you, we did something which is not even happening in the United States. You might have noticed that when a lot of these scientific panels happen, many times it's just men, right? Women's issues, right? How's that supposed to work? And so at the Aga Khan University, we have literally created a policy outlawing what's been commonly known as manels, like men-only panels. We basically said you can't have a scientific panel or committee must have gender balance in it. This is like a now policy of the medical college. And when I spoke, I was at Johns Hopkins this morning, and when the dean there, she knew about it, and she was like, "Wow, how did you get this thing passed? Because I'm trying to get it passed and I can't." Right? So it's incredible what you can do if you put your mind to it. But maybe a little bit more, Shah.
Just a few other statistics about women empowerment. A lot of our nursing students nowadays, they come from northern areas. To come to a university and get education, and through that, their entire families are lifted out of poverty. In addition to nursing, we have women employees, we have women engineers working at the university. We have women in IT who are working, and of course, women in leadership roles in HR and accounting. So places where you would not expect. Our first chairperson of the Department of Surgery was a woman. So AKU has a long tradition of empowering women and supporting women in their careers.
And just to be clear, I think that's one of the reasons why we've been successful. Right? So, to be clear.
Do you have a student exchange program with institutions?
Yes, we routinely send students for electives. And it goes decades back. I, as a student, rotated at the Mayo Clinic, and that was my first exposure to U.S. systems. As I mentioned, Zainab, the person I talked about, she's rotated at Duke, and till today, our students we're grateful that they get to come to some of the best institutions in the United States. And of course, it's a reciprocal thing. We routinely take students, because of COVID right now, that's been put on pause. Most places, the elective's on pause, but hopefully we'll be able to restart it. One thing that I think even today somebody has mentioned, and something we're considering, and if there's enough interest, we will probably look into this, is to create a program for undergraduates in the US that want to come to Pakistan and spend some clinical time, get some clinical exposure, even if they're pursuing medical college here in the United States, but be able to immerse themselves, especially if they're of Pakistani origin, to learn a little bit about their heritage, spend some months in Karachi. We've thought of a program like that, and if we find enough interest after COVID, we will certainly pursue it.
Go ahead, just ask your question.
Okay, so thank you so much, first of all, for presenting such a beautiful presentation, and we are really thrilled to see what Pakistan has to offer, what Pakistan and especially the AK University offer. And as I was going through Dr. Shahid's presentation, it said first, everything first, first, first. And I really love that first thing. And I'm really inspired to see all that. Although we not from that part of the country, we belong to Pakistan, but we are so busy in our day-to-day life here, so-called American lifestyle, that we forget sometimes. But this is a nice gathering here where we are all together and celebrating our accomplishments. So I take that opportunity for myself, and as my family is all here too, to introduce myself as specialized in a very specialized field as a rehab practitioner and doing prosthetics and orthotics. I graduated in 1994 from Peshawar Khyber Medical College and doing the prosthetics and orthotics. I went to Germany to do my master's and PhD programs over there, and ended up landed here in the United States and never left the country. So I'm also the first Asian Pakistani woman who's a gold medalist in the rehabilitation. Thank you. So now I take this opportunity to see when I was going through the presentation, I'm asking this question: are there any facilities available at the Aga Khan University hospitals to facilitate for rehabilitation, for amputees, for crippled, for handicapped? Back then, when I was about to join the program, I came to know Dr. Philip D'Souza, your orthopedic surgeon, and I'm feeling proud to mention his name because he was the one who inspired me to move forward with this program.
That's wonderful. I'm really story. And there are many stories like this. I want to make two comments here. One is that at AKU we do have a full department of physical therapy and rehab medicine, and we specialize in multiple areas. But there's always room for growth. So we'll be happy to talk to you about that. There are other areas, other institutions that are also providing similar services. Obviously they're not at the same level as you would see here. But the second point that I want to make is that the Pakistani diaspora that is living in the US, there are multiple ways to serve Pakistan. Not all of it requires going back to Pakistan. And I think a lot of us feel that if we are living here and we are living a busy life and we are living a good life and we are raising our kids here, somehow we are shortchanging ourselves. Please don't think that way. I think it is great that you all are here. We were here, and we are all product of the opportunities that US has provided us. And it is great that you are progressing here, and everything that you do, every time you succeed here, it is a success for Pakistan. And for our alumni, I tell them that if you succeed here, it's a success for AKU. So the university's vision is not simply to uplift one part of the world. The university's vision is to uplift people wherever our people are. So I think wherever you are, wherever you're serving, it is great that you serve your community there. Thank you.